Welcome to the NCCH Healthy Built Environment Online Discussion Forum webinar. This webinar series is a part of the NCCH Healthy Built Environment. Sorry, everyone. I don't know where that's coming from. Please keep your phones on mute for those of you on the phone. Okay, so the goal of the forum is to identify healthy built environment initiatives and projects and to promote networking and collaboration. My name is Tina Chen, and I'm an environmental health and knowledge translation scientist here at the NCCEH. Here with me today is Linda Bonimus, who will be helping me with the technical aspects of the webinar. So today we have the great pleasure of having Amy Lubik, who is a health policy analyst and researcher at Fraser Health Authority. Dr. Amy Lubik works on the social determinants of health, broadly on how issues such as poverty and unequal access to housing, transit, and services impact health outcomes. She also has experience researching how the built environment can influence health, focusing on the mental health aspects of social isolation, as well as municipal resilience to climate change. She is also a member of the Canadian Association of Physicians for the Environment and the Public Health Association of BC, and is a first-term city councillor in Port Moody, BC. This webinar will begin with a 30-minute presentation followed by a 45-minute discussion. Because there are quite a few of you online, we will only be using the chat box for comments and questions during the discussion portion. Hopefully, you've all had a chance to review the discussion questions sent previously and are ready to provide some input. So after the webinar is completed, we'll be sending out an evaluation survey. Thank you, everyone. Now over to you, Amy. Sorry for the interruption.
Thank you very much, Tina. Can you hear me okay?
Yes, I can. Thank you.
Fantastic. Thank you again for inviting me to present today on the health benefits, particularly around social isolation of co-ops and co-housing. This is something that I was working on at the BC Centre for Disease Control, and I'm very passionate about this idea. So we're going to start with a bit of an overview on social isolation and the health impacts, and an overview of the built environment and how that impacts social isolation. Then move on to co-ops, co-housing, Indigenous co-housing, and equity considerations, and potential policy considerations. And I'm especially looking forward to the discussion to hear people's thoughts and comments and suggestions. So firstly, social isolation is defined as disengagement from social ties, institutional connections, and community participation. Social exclusion, which is slightly different, is defined as a lack or denial of resources, rights, goods, and services, and the ability to participate in normal relationships and activities available to the majority of people in a society, whether economic, social, cultural, or political. And I think it's important to keep those definitions in mind as we move forward. So we know that social isolation in Canada is growing. In a report from the Chief Medical Health Officer in 2017, we saw that between 2003 and 2017, most Canadians are seeing their family less, as well as seeing their friends less often. From a study in the Vancouver Foundation, there will be technological difficulties, I promise. But in the study from the Vancouver Foundation in 2017, they were looking at sense of belonging in communities, and that we're starting to see a decrease in sense of belonging, even though Vancouver has been trying valiantly to increase social belonging in their community, in Metro Vancouver. And this is especially prevalent among 18 to 34-year-olds and people in low income, which is not a segment of the population we often think about as far as social isolation. In this study, they were suggesting that it's potentially due to having to move around a lot and move away from networks due to housing insecurity. So it could be one of the factors that's involved in social isolation in the Metro Vancouver area. So in Canada, the people who are most likely to suffer from social isolation are people of low income, seniors, Indigenous people, those with mental and physical health problems, newcomers to Canada, and the LGBTQ2S community. The health impacts of social isolation are increased levels of anxiety, depression, strong correlations with heart disease and problems with blood pressure, increased risk of suicide, and folks who don't have a cohesive support network tend to have poor mortality rates when it comes to cancer. There's also an association between social isolation and increased cognitive decline for people who are suffering from dementia. And on a community side, high levels of social isolation are associated with high levels of crime and alcohol abuse, as well as a reduction in those social buffers that help us as human beings kind of get through our day-to-day stressful situations. And I would be remiss if I didn't bring climate change into every one of my presentations. People who are socially isolated tend to be more vulnerable to extreme weather events due to climate change, as well as any natural disasters. In the 1995 Chicago heat wave, the people who were most likely to pass away were those who were marginalized, socially isolated, or low income. And in neighboring communities where people were very poor but didn't trust their neighbors, people more likely to pass away, compared to equally impoverished neighborhoods where people were connected to each other and mainly lived outside and were connected so they could take care of each other. So municipalities can do a lot to impact social isolation. Taking in things like neighborhood design, equitable access to green space. We do know that the more affluent people in our society tend to have higher access to green space and quality green space, and also influencing policies around affordable housing. We know that even passive socializing may foster social connection and lessen social isolation. And a large number of informal ties provide a feeling of home, security, and belonging, which are key determinants of human health. And so that's things like walking down the street and passing that person that you know is always taking the bus at the same time as you, or going home at the same time as you, or getting to know the people in the coffee shops that you frequent, or the people who are always walking their dog past your house. And housing suitability is also linked to mental health across all ages and incomes. Communities are starting to get more involved in this. Sorry. I thought I heard somebody asking a question. But communities are starting to get more involved in taking on social isolation, particularly in the UK. Some municipalities are partnering with family physicians. So when people come into the doctor's office looking for treatment for something that's actually more of a social problem, they're starting to prescribe things like book clubs, exercise groups, workshops, or men's sheds to create social connections. And what they're seeing is this is actually starting to at least correlate with a dramatic fall in emergency room hospitalizations. And the United Nations generally says that cities can play a really important role in social inclusion by planning for accessible and safe neighborhoods with ample gathering space and housing, potentially by focusing on the most excluded, I should say, people in society. A few years ago, we did a study at BC CDC asking municipalities how much they did take social isolation into account when they were doing planning. And most really seemed to want to do something, but weren't entirely sure how. And so we did a study looking at the different ways that municipalities can actually impact social isolation or social inclusion. And we found 4 and then 5 main ways that they can take action. The first, and you can see the graph at the top of the screen, is looking at the relationship between the number of land uses and social capital or social connection. And that makes sense if you think in a small area, if you have a lot of different housing types and tenures, as well as, say, coffee shops, park spaces, grocery stores, places where people connect. We also looked at mixed use and neighborhood design, and there's a high correlation between social connection and accessibility, which again makes sense if you think about having proper sidewalks where people can get out and feel like somebody actually cares about them. Neighborhood maintenance can be a big problem with that as well. I won't be talking about public transportation in this particular presentation, but it is important. And I'll move on to density in a minute. And the last thing that we're going to focus on today is we started thinking about cohesive housing, and that came to co-ops and cohousing. So density is starting to be a bit of a contentious issue in a lot of municipalities. We know that suburban sprawl isn't good for social connections, but also density, when it gets to extreme density, can also lead to a sense of social isolation if people don't want to connect with their neighbors if they feel too overwhelmed. And social isolation in high rises can be a particular issue for young mothers and their children. And the reason I wanted to touch on these factors is that co-ops and co-housing kind of bring them all together in a smaller place. It's kind of a good balance between density and not so much density, I should say. So we're going to start by talking about co-housing. And co-housing is a collection of houses which are typically smaller than most condominiums to allow for shared spaces, arranged in such a way to allow for physical contact between members with good visibility into all communal spaces, a gradual transition between public and private spaces, and semi-private outdoor spaces where socializing can take place. It's kind of close to people's houses, but still a shared space. And also having lots of access points to different communal walkways. The design of co-housing is often having windows that give an eye on the street feel. So it feels like your neighbors are watching out for you. And this helps also with child rearing. If you let them go out and play in a safe space, like a communal garden or a gathering space, generally you'll feel like somebody is paying attention to them, and generally someone will be. In co-housing, there's generally common spaces, including a common living space, kitchen, dinner, entertainment areas, where they have shared meals at least a couple of times a week, hobby rooms, laundry, facilities that are all shared, a shared guest room, which helps cut down on space, and different shared garden and storage areas. Co-housing is generally designed by the people who are going to live in it, so it can be very accessible depending on the needs. And it all comes together and is run on a consensus-making basis, so that it brings a sense of belonging and shared identity.
You guys do that?
I think there are some people who might not be on mute, which is okay, but just in case you didn't want us to hear you. So a few weeks ago, I had it might have been a month ago now, the opportunity to go actually on a co-housing tour in Metro Vancouver. I went with a city councillor from New West, and we looked at Quayside co-housing in North Vancouver and Cranberry Commons in Burnaby. And when I was mentioning these ideas of semi-private, semi-private, semi-public spaces, Quayside Village is a really good example of having kind of shared outside balconies you can see on the side, where people have a lot of garden pots and outside furniture where they can sit and enjoy their own balcony, but still, if neighbors pass by, they can stop and say hi, go over, borrow a cup of sugar, whatever you want to do. And it's a really lovely feeling in those communities. So most co-housing establishments are designed to facilitate a supportive community where residents can get access to various forms of help, including cooking, sharing communal meals, gardening, maintenance, and childcare. And in some of the Nordic countries where co-housing first took off, a lot of the focus was actually on sharing child minding responsibilities. To touch on the communal cooking aspect, especially for elders, when you live alone, you often don't feel like cooking or eating meals alone because it can feel really isolating. In co-housing communities, people don't have to share meals, but they often do. And people can choose to participate or not. And that can be really helpful for folks who are socially isolated to be able to just share a meal with people and feel connected. And there's actually a high correlation between type 2 diabetes and social isolation. Co-housing residents also report high levels of belonging, self-esteem, and self-actualization. And a lot of that apparently comes from sharing responsibilities and helping take care of their neighbors. Only about 12% of people living in co-housing so this is a study that was done in Denmark that looked at how prevalent having to leave one's home for medical treatment was. And in co-housing communities compared to the surrounding areas, only around 12% of people were in need of care compared to 22% of people in the surrounding areas. For people over 50, the difference went from 16% versus 33%. And co-housing has been suggested as a supportive environment for more elderly people to age in place, with neighbors allowing for help for people to remain in their homes. And in fact, people tend to live in co-housing for 8 to 10 years longer than people in more typical community settings. Some seniors co-housing are purpose-built, so that goes back to the accessibility piece. And they're purpose-built sometimes with places for caregivers to actually live, so people can stay in their communities even longer. Now, a lot of co-housing communities are tailored to whoever builds them. And so there can be elderly or more adult-centric co-housing, but a lot of it actually is family, which can create a support network for teens and for those folks, younger folks who tend to be more socially isolated or can be. And there's a lot of opportunities for mentorship. One of the benefits of co-housing, going back to elderly folks again for a moment, can be the shared workshop spaces that are often included. We forget sometimes that men over a certain age, especially after retirement, are at higher levels, or higher risk of social isolation due to losing contacts when getting out of a working environment. And having a shared workshop space is a little bit like the idea of men's sheds, which is starting to pop up all over the Western world, where men can get together and work side by side and get to know other folks in the same situation. So in Quayside Village, some of the benefits of living in co-housing that people brought up were the opportunities to have a small business, even in the common rooms, and using the shared space for that. There was a lady who was using the common space for giving piano lessons, and some of the residents were starting to go down and actually listen. And I'm assuming that's for some of her older, more accomplished students, but some people might like Three Blind Mice. And they even often have, I should say, in the Cranberry Commons, they mention the benefit of having a shared guest room, where if someone's residence was on a higher level of the co-housing unit and they got sick or injured themselves, they could use that spare room while they were recovering. Now, one of the benefits that some of the co-housing residents talked about was that it's almost like seeding community into the wider community. So co-housing often takes quite a while to get going, and there's a lot of community consultation that's involved. Some people tend to think that it could be insular, but often, I guess not every co-housing, but at least the couple that I've interviewed, open up to the wider community. So they've had fundraisers in the common rooms, they have community meetings in the common rooms, they share the gardens and the play spaces. And it's a way for the wider community to use those spaces as well. So unfortunately, co-housing isn't necessarily affordable housing the way we would usually think of affordable housing. It's more affordable to live there because of sharing of resources, but generally it's self-funded, so people need to have a certain income to actually get these groups started. There is an increased interest in partnering with nonprofits to get some of these going, with an inclusion of more low-income folks. And in fact, in North Van, the city, I believe, owns at least 2 of the units to keep them perpetually affordable for renting. So there are ways to make it slightly more affordable. Interestingly, in a 2012 study, particularly for folks who are more elderly, co-housing does tend to be more affordable than other care options. Co-housing has similar health properties associated with it as far as social isolation decrease, but they tend to be more affordable. So the Cooperative Housing Federation of BC states that co-ops are made up of people who are socially, ethnically, and economically diverse. And some co-ops are established especially for socially excluded citizens, either those with mental or physical disabilities or those folks who are under financial hardship. And usually they're owned by a nonprofit or a partnership and run more by a strata, whereas co-housing tends to be run more by the people who live there. Much like co-housing, though, residents do take part in the maintenance often. And in a study of a co-op in Atlantic Canada, residents who came to be in the co-op from more distressed housing or from the streets felt a significant improvement in their general well-being and perceived safety, often because of the importance that they placed on being able to help and connect with their neighbors. And as we were doing these studies, one of the most interesting papers to me that I came across was a study by White Harvey in 1993. And he talked about Indigenous co-housing perhaps being the oldest form of co-housing of all, predating colonization. Longhouses have been used by nations, including the Iroquois Nation and the Huron Nation, for, well, hundreds, if not thousands of years, or I should say thousands of years. And right now and I'm not trying to talk on behalf of anybody, this is part of what was found in the study, or that a lot of the housing on Indigenous reserves tends to be more of a Western or colonial style housing. Similar to co-housing, longhouses vary in design, but typically consist of 2 rows of housing, each facing each other, with a common area in between, sometimes covered depending on the climate, providing space for multiple families and generations to live in close proximity without overcrowding. And overcrowding is a problem that some housing on reserve is seeing, especially for younger generations. So co-housing or longhouses could provide structures for intergenerational support, facilitating shared meal preparation, shared child raising, as well as the potential for alleviating loneliness in adults, and enhancing the passing of traditions to subsequent generations. Also, the lowest income members of a society of a co-housing unit may be encouraged to share food and actually, have good nutritious meals. Also, as was mentioned, with all kinds of co-housing, shared spaces such as craft rooms or libraries or community areas can offer spaces to pursue in-home businesses. And there's actually some nations that are starting to try this. In the Puyallup Nation in Washington State, they're starting to build a similar dwelling type. And in Vernon, BC, they're making, there's a nation doing a tiny house village, which is kind of similar but disconnected. I wanted to touch on this because it's a bit of a good news story that is somewhat like cohousing. So in Portland, there was a tent city that was a bit of a not as welcome in the community. But they partnered with a nonprofit and the city and started to make tiny homes for their residents, and basically have a tiny home village with a shared space, communal space, and services for the community there. And they've really helped people get back on their feet. So some of the ways to promote co-ops and co-housing could be to incorporate social needs into the physical or economic definitions of housing standards, identifying and changing barriers that impede the planning and regulation of these kind of housing forms, which is something that I think Vancouver is in the process of doing now that they've now that they have a couple of co-housing establishments completed. They're starting to understand the process a little bit better. So I'm looking forward to learning more from them as well. We can incentivize co-housing and co-ops by providing land or subsidizing land, city land for use, although that tends to be more for co-ops. Allowing for more density in co-housing in order to subsidize some of the units for purchase or rental below market, or facilitating partnerships with nonprofits to allow for the creation of co-housing and co-ops. Incorporating social sustainability into a sustainability checklist, if that's something that a municipality that you live in or work with has, and giving more weight to developments that have some of the properties of co-housing. Also allowing for retrofitted co-housing into communities. This is something that I haven't seen a ton of examples of as of yet, but in a couple of places in the States, neighborhoods have just kind of torn down some of the fences in between different neighbors and created their own small neighborhood community spaces. I think this requires the community's permission and probably landlords, because in some cases they are these establishments have been rentals. But it's a very interesting idea. And that's it for my presentation, but I'm really looking forward to hearing people's questions.
Thank you, Amy. Portion. We'll start with some questions that were in through the chat box. Do we have any questions in the room here? Okay. So the first question is, what is the difference between co-housing? Presentation is very interesting. In gated communities. Now, I guess we'll go to the discussion for that gated communities tend to isolate residents from residents of the wider community. Yeah, I have heard that too. Amy, do you have any thoughts on that? Or anybody else in the group has any thoughts on that? Feel free to. Portions are meant to be discussion, conversations, dialogues between participants as well as the presenter. So feel free to chime up.
Sorry, Tina, could I just ask that question or comment be repeated? I couldn't quite make it out.
Co-housing and gated communities. There seems to be of the wider community.
So is the question, what's the difference between co-housing and a gated community?
I have heard that gated communities tend to isolate. Sorry, Erica, are you saying that my audio is cutting out a lot?
Yes.
Okay. Sorry, let me just see. Okay, is this better? Hopefully, I won't be cutting out as much. Okay, thanks. Okay, thanks. So yeah, if anybody wanted to speak up, or if Amy, you have any thoughts on that, or any input on the difference between co-housing and gated communities?
Right. I think the biggest difference is that the co-housing tends not to be, well, gated. I guess in a gated community, okay, let's think about that for a second. In a gated community, as far as I know, there often aren't as many shared spaces, or shared meals, or shared chores. So usually in gated communities, as far as I know, there's a strata that takes care of things. So residents don't necessarily have as much connections with each other compared to co-ops or co-housing. I'm not as familiar with gated communities, but I'm not sure that the public is often invited to take part in their activities.
Right, because co-housing is, yeah, if Tanya, if you could speak up and say if, and follow up on your question. But yeah, I think co-housing tends to have, it feels like that co-housing tends to have more shared amenities and more contacts and social interactions between members, whereas gated communities might be, single family houses in a gated community which don't have as many shared amenities and things like that.
Yeah, co-housing tends also to be driven by the residents, so it's designed specifically for the folks who live there, for their kind of wants and needs and interests. At the same time, they can tailor it. So in one of the co-housing places that we visited, they created one of their shared spaces, one of their shared rooms, into a teenager room in particular, where kids could basically escape from, I shouldn't say escape from get some private time. And they, put video games and books and computer in there. And so they could really tailor the space to the needs of the community, versus I think there's not as much opportunity in a gated community to do that, because you probably have to deal with strata more.
Right, thank you. Yeah.
Amy, this is Sharito. I just wanted to follow up because I'm just thinking about this idea of gated communities now. I just wondered what you think about the actual physical presence of the gate, because I think that's one of the things that make it unique, is that the gated communities, it's like a form of residential housing, but there's the entrances are very controlled and the exits, and I think that's what characterizes a gated community. And I'm assuming that the purpose of that is around safety concerns. But what are your thoughts around does the presence of the gate actually address the safety issues, or is that kind of antagonistic? Do you have any perceptions on that?
So my understanding with co-housing is that during that initial phase of planning, there's a lot of community consultation and kind of outreach into the community, versus a gated community is done by developer, put up. The community consultations would be more around, I guess, whether you want the development there or not, versus, would you like to be part of that community? I think the gate itself, it is there for people's feelings of safety in a gated community, but for the wider community, would generally feel like you're excluded from that area. Whereas my understanding, at least, of the three co-housing, four co-housing places that I've talked to, is that they really do want the wider community to feel like they're part of it. I think the safety from, like, there is an increased feeling of safety in co-housing communities, but I think a lot of that feeling of safety actually comes from feeling like your neighbors are watching out for you versus feeling like the gates are up.
Right. Huh. Okay, thank you. It's just interesting.
It's a very interesting question.
Thank you. Okay, so next question. Is there a correlation between social isolation and housing density? That's houses per square hectare. And further, is there correlations between social isolation and homogeneity of a society?
Good question. I don't think that we have we don't have a perfect density figured out yet. We know that in very high towers, socialized over, I think 25 stories, we tend to see higher levels of social isolation. And we see more social connections in more low-rise buildings. I will find that study somewhere, but compared to high-rises. There are some studies showing high density versus low density having higher levels of social isolation, but I don't think we have that figured out to actual numbers. Can you repeat the second part of the question?
Yeah, are there correlations between social isolation and homogeneity of a society?
Homogeneity of a society, like, well, I guess like any aspect. I have not read any studies on that, to be honest with you. I'm trying to think if the study is relevant or not. There was a study done in areas of I'm going to check my notes on this one, but there was a study done in, I believe, just outside of Portland, Oregon, where they looked at a new urbanist community. First, it's not co-housing, but a new urbanist community. So it's kind of like medium density with lots of shared shops and services and transit and things like that. They saw originally that the community was very, very similar in ethnic diversity and in, or lack of ethnic diversity and income and things like that. But as the community grew and actually got more connected to each other, started to feel higher levels of social connection as opposed to the other surrounding neighborhoods. This is over a 10-year period. They started actually wanting more diversity and welcoming more diversity in their community when asked in different surveys. And that was both from different backgrounds and different economic backgrounds. I don't know if that quite answers the question, but I think finding a way to develop communities that allow for people to get to know their neighbors and feel like they aren't that scary helps people be more accepting of people from different backgrounds.
Okay, thanks. So next question, this is more of a comment. The Longhouse motto that you mentioned, Amy, the comment was, it tends to be a family design style, but with a larger definition of family. And another related comment about the Longhouse motto is that it's important to sorry, I'm just looking for it right now. To follow up to a Longhouse statement, need to ensure that we do not look at this as a pan-Indigenous model, as there are over 600 First Nations across Canada.
Oh no, for sure, and I appreciate that clarification. No, there's no model, and of course, longhouses are traditional for every nation. It's just a very interesting concept, and of course, anything that is done should be done in complete consultation with communities and, well, hopefully community-led, if it's something desired for a geo community.
Right. And Amy, are you aware of any, so this comment is about joint family system in Asia and Israel, and they're still in practice in those countries. Are you aware of any commonalities between the co-housing styles here versus the ones in other countries?
So the majority of studies that I was reading were on co-housing, the couple that are in North America, because it's not as common here, and the ones in Scandinavian countries mainly. There are countries that are starting to try to design whole neighborhoods around the idea of co-housing, those kind of features. But as far as Israel, I believe, I don't want to generalize, but I believe they might be talking about a kibbutz. Is that the form that they're talking about, or?
Yeah, I'm not entirely sure, Karuna, if you could just follow up to say that, but go ahead, Amy. Yeah, let's assume it's a cookbook, as you said.
Kibbutz, I think. We did look at the similarities of that just in trying to find a good definition for co-housing. In some of those areas, in some of the kibbutzes in Israel, there's more of a shared income as well. So sharing of economic resources, which is not necessarily how co-housing is done in I guess Western countries. So you know, in kibbutzes, there's generally a farm attached where people do some working. That being said, in Chilliwack, there is a eco-village that is a new type of zoning, actually, that they created to create co-housing and also farmland, and also sharing, selling some of the produce and honey and things like that they actually grow. So that's kind of a very cool model, somewhat expanding on the idea of co-housing and getting, I guess, a bit more towards that more kibbutz style. Although I don't know that they would call it that per se, so I shouldn't generalize. It's more my perception of that.
Right. Interesting. So that is related to this next question. So how does it work with, how do co-housing facilities deal with shared expenses? So I think you mentioned co-ops do have strata and associated strata fees, and they often will have contingency funds accumulated. So do co-housing units also have a strata, and if not, how do they deal with shared expenses?
That's a very good question. My understanding is that there are shared expenses put away for if there's an emergency. And I'm assuming that there's something to the effect of a kind of like a strata fee that people would pay, like a maintenance fee, that would go into a general kitty. Because generally decisions are made by all of the people who live there. One of the experiences in one of the co-housing places that we visited was that people rotated different tasks that they were responsible for. So I guess for as far as sharing expenses, there's probably someone in charge of expenses for part of their tenure, but I'm not entirely sure of that.
Okay, thank you. Next, Sabrina mentioned the City of Vancouver walked through a project which looked at higher density buildings and social connections. The Hey Neighbor program highlights the impact that increased sociability can have on mental and physical health of the residents, and the role that municipalities, residents, and the housing industry can play in cultivating these connections. So she did share a link for those of you who are interested in that. Next
love
comment. Perfect. And so next comment, are gated communities not a form of planned social isolation masked as safety issues? It is the more affluent in its given society, excluding the poor.
Is that a question?
I think it was more of a comment.
Okay.
Okay, and so yeah, go ahead. Did you have anything to say, Amy?
Yeah, I guess, some people can gravitate toward a gated community for feelings of safety, but I've not studied that, so it's more of a personal opinion. I would feel more excluded if I was behind a wall.
Right. Right, and it's okay. Next question or next comment. I guess co-housing is it was a solution for young workers and low-income families 20 years ago in China, but it has disappeared for a while and been replaced by higher buildings. Next comment. Social isolation decreases with increase in density. However, if the density becomes more dense, then we see a decline in social connections. What would be the critical limit, like total population per co-housing, to be effective?
The total population for co-housing to be effective. Typically, co-housing is between 15 and 30 units. That said, when I was talking to some of the folks at Cranberry Commons, there are co-housing units that are bigger than that, but tend to have kind of more kind of separate, let's say, buildings. So maybe 2 co-housing units that share more, just because it gets complicated as you bring in more people to have sharing of responsibility. That's why sometimes co-ops can be a little bit easier, because there's a strata versus everybody trying to make a decision together, so they can be quite a bit bigger than co-housing. But that said, if you had a couple of buildings that were 30 units designed properly on a bigger area, that's apparently fairly manageable. But I don't think that we have a particular magic density figured out as of yet.
Okay, thank you. So we're going to move on to discussion questions. We have a little bit more, about 15 minutes more left, 15 to 20. So I am going to share the discussion questions on my screen here. I hope you can all see it. Okay, so first question, what are your experiences with co-ops and co-housing, either personal and professional? Does anybody have any comments? Have you worked with co-ops and co-housing in the past? If you want to speak up over the phone, you can, if you'd like. Just let me know and I can unmute you, or I think you can also unmute yourself. Are you aware of any co-ops or co-housing in your cities or in your jurisdictions? So Erica said no, there's not aware of any co-ops or co-housing, or no experience working with them in the past. I know in Vancouver there are quite a few co-ops, but I'm not sure about co-housing. I haven't heard of the co-housing model in Vancouver. Yes, and Sabrina said Vancouver has quite a few co-ops in the city.
Vancouver does. Port Moody, where I'm from, has a couple of co-ops as well. I actually thought about going into a co-op at one point because friends that I know live in it, and I love it. it's such a wonderful community-oriented space. And the kids, all get out and play in the common area. I think Vancouver actually has one co-housing, at least, community. And I've been there a couple of times for different community events because they do open it up to the wider community. Yeah, it's a very neat space. There's lots of community gardens involved. So a lot of people share herbs or whatever else that they grow. And lots of kids running around, and the shared spaces, the shared community kitchen is is lovely. I think there's one other co-housing development that's being planned in Vancouver, but I'm not sure where that is.
Yeah, I think Sammy just piped up and said, is the co-housing in the Falls Creek area? I think it is in the Falls Creek area, yeah. So that's in the waterfront area of Vancouver, Falls Creek South. Sabrina just shared a link to that. So he said there are very few, if any, on reserve that I know of, have been working on approximately 70% of reserves across Canada. And he also said, I believe a concept similar to this could work, but to have a given reserve, we need community buy-in from the reserve.
Would have to have community buy-in from the reserve?
Yeah.
Oh, completely agree.
Yeah. Okay, well, let's move on to the next discussion question. If you have more thoughts to add to the first question, feel free to type it into the chat box. Oh, Svelana said, I find some of the co-ops in Vancouver can be exclusionary. There are co-ops built in the 50s and 60s in that they often have age limits. For example, residents must be 19 years and older, etc.
They have very
and co-ops have a very long wait list right now. Yeah, for sure. So how do you think public health could promote co-ops and co-housing, if you agree they should? What are the avenues in which public health can do so?
I would really like to hear more from folks on the line if they have ideas. Depending, yeah. I mean, I think even just informing municipalities about the healthcare benefits can be helpful. And because most of the municipal officials that I know who have heard about it are really excited about the idea, but they're not quite sure what to do. And as long as, especially around the social isolation issue. As I mentioned, like Chilliwack did do zoning, particularly for Eco Village. And I think even just asking, I don't know if public health can even do that, but I think people get excited about these things when they come up, but they're not quite sure what to do. And having some guidelines would be really helpful.
This is Sharito. I so love the idea of a co-op, and I'm sure that I'm romanticizing it a little bit because I've never lived in one, but I kind of imagine this idyllic like relationships with your neighbor and everyone cooperating and there never be any conflict. I'm sure it's more complicated than that, but anyways, I wonder like if the question is around public health and how we can even as communities support the ideal of living cooperatively with neighbors. I kind of imagine like the context of a co-op broader to the community and would love us to have that vision of working more cooperatively with our neighbors as a community-wide lens. And I wondered if there might be some opportunity for like when you talk about the chores and like the criteria for being like more involved in participating the public space of the co-op, for if there's opportunities for the neighbors of the co-op to also support that. because like when you mentioned community gardens, there's so many neighbors now. Like I myself, we don't have a backyard. We live in a townhouse with just concrete. And I would love to be able to support our next door co-op, which is just down the street, if they needed help with their garden or something like that, to build relationships between the co-op residents and their immediate neighbors as well. Mm-hmm.
I really love that idea. I think one of the co-ops we visited, they did have a couple of their beds that they shared with their neighbors.
That's awesome.
A couple of their garden beds that they shared with their neighbors. To kind of bring the community in a bit more, which is really neat. I also live in an apartment building, so I can't really have much more than a couple of pots in a garden as my garden. But there are some municipalities that are trying to promote, I'm trying to remember the term for it, but basically sustainable neighborhoods. So getting to know different ways to get to know your neighbors so you can take part in a more communal living style. In Portland, they do a lot of placemaking with, well, I shouldn't say they. There's a couple neighborhoods that do a lot of placemaking with their neighbors and build capacity that way.
Yeah. Okay. So a few comments online. Keith said community gardens are quite common in the Southern First Nations, but a bit of an issue with the more Northern First Nations. Question about if there's any regulatory change to make co-housing concept be successful. Would regulatory change make the co-housing concept more successful?
Subsidization would be very helpful, I'm sure.
Yeah.
It's been a long time since get political here. I don't think there's been a lot of co-ops done since like the 70s or 80s by any level of government. And I think bringing that back would probably be very helpful. I think, trying to have to include co-housing concepts in government housing would be fantastic. In Denmark, I believe, and some of the Nordic countries, as I mentioned, municipalities are trying to start planning neighborhoods around this kind of model. So it doesn't necessarily have to be a particular co-housing unit itself. If kind of like what Sharita was talking about earlier, with cooperating with neighbors and designing a neighborhood in such a way that there is a lot of those shared facilities and shared amenities.
Right. So next question. Could co-ops, co-housing be a potential solution for housing stability for low-income families, homeless, or other people if government subsidization takes place? Yeah, I think that's what you were talking about, Amy, right? If they were subsidized.
Yeah, I think if they were subsidized, for sure. It's one of those things that apparently living in co-ops and co-housing, living in co-housing is cheaper in the long run, but there's considerable startup costs. So there are programs starting to take place where there's more partnerships with nonprofits, et cetera, and different municipalities, but those aren't as common, at least in the North American model, as far as co-housing. You probably need some help to make them slightly more affordable. At the same time, it's still not affordable for really low-income folks, but if the process can get streamlined by a municipality, it does decrease the cost somewhat from a waiting point of view.
Mm-hmm. Amy, does your article, the one you published quite recently, does it also talk about how public health could promote co-ops and co-housing? Should I share that article with with others when I send out the evaluation survey?
Yes, please do.
Okay.
Yeah, there's a couple of different ways that health professionals in municipalities can promote, but it's a new concept, and still looking for different ideas. That being said, at least in the States, there is a co-housing conference coming up for municipalities, so I wish I could go to that to talk about different ways that learn different ways of promoting it.
Okay, so next discussion question then. What are the implications for the general community? So I guess how the general community perceives co-ops and co-housing, and what they think about having these types of housing forms in the neighborhood. Well, I mean, personal opinion, I think they'll be welcomed in the neighborhood.
I can't imagine there being a negative reaction to it. Have you heard of it being negatively received, Amy?
I've not, but I think there's a group trying to get a co-housing development going in Maple Ridge, and they're spending a heck of a lot of time on community consultation with the neighbors. So by the time they get it up and going, they know that they'll have, their neighbors will be welcoming them. Their neighbors will know that it's not an insular community, that they are welcome, to take part in activities and things like that. I know every time I've asked if I can go visit a co-housing community, it's always like, well, this night we're having dinner, so please come join us. And it's quite lovely. So anytime anyone offers me dinner, I'm pretty happy that they're in my life.
Anyone else have any thoughts on that?
Amy, it's Sharito again. I was just thinking about what Keith Smith mentioned in the chat box about on reserve Indigenous communities. And I was just curious, and I'm so new to this concept, so forgive me if this is not a good question, but have you ever heard of co-ops on reserve, or is that something that maybe called something else?
I have not, and I'm not an expert on that. I'll be completely honest. I've only heard of co-housing or tiny houses on two different Indigenous communities. I have been looking for examples, and I have seen newspaper articles where people are thinking about it, but it's not widely publicized, so it's harder to find. I've never heard of co-ops on Indigenous reserve, but I'd be really happy to learn if someone knows about that.
Yeah, me too. If anyone, please put in the chat box if anyone has insight or experience with that. I'm super curious as well.
I think Keith mentioned a little bit earlier in the chat box that there are very little in on reserve.
Yeah,
not sure. I think he was talking about co-ops, and not sure about co-housing. I think, Amy, you said a few reserves or a few communities are trying to bring back the longhouse concept and the co-housing concept.
There's a couple communities that are trying to do that. And this is more from the news than from academic publications or even gray literature, just trying to find examples. But I'm not sure that they're always widely publicized. And my understanding is they're usually community-led. At least in the couple that I've read about.
So a question came in. What are your views on privacy and individualism when living in co-ops and co-housing?
So I guess one of the benefits that came up in literature with co-ops and co-housing is that there's a lot of shared spaces, but if you don't feel like socializing, you don't have to. Like, you do have your own residence. So if you go in and shut your door, it's not like someone's going to come get you. So, you know, other than whatever chores you're responsible for, and, you know, maintenance that you're responsible for, or shared tasks that you've taken up voluntarily, I don't think anyone is forced to do anything. So I think that they're actually a fairly good, mix of privacy versus being part of the wider community. I hope that answers the question.
Yeah, no, I think that's great. I think, yeah, definitely. I think in co-ops and co-housing, like you said, you live in your own home, but there's a lot of resources that are shared, like the workshop idea, or you know, shared common area where you can, you know, get together and have piano lessons, for example, and things like that. Okay, so moving on to the last discussion question. Are there any potential environmental or equity impacts related to co-ops and co-housing?
Okay. So I guess what I wanted to just mention about that, but I again really want to hear from others. The co-op, the co-housing communities that I have visited have been very environmentally focused. Like down to having different people responsible for the recycling of everything from batteries to old gadgets to all different kinds of plastics. So everybody is responsible for recycling absolutely everything, and don't necessarily have a lot of garbage because of how much they actually recycle. I mean, the co-housing that I have visited has been, well, they said that it was particularly low emission because of the way it was built, and you know, the sharing of, let's say, laundry facilities, etc. I suppose can also lower the water usage. But it can be designed specifically to be environmentally friendly. The co-ops that I know of tend to be older, so not as energy efficient, unfortunately. But one of the things that seems to be happening with some of the, at least co-housing that I was visiting, people had less and less cars. There are fewer and fewer, I should say, cars. There's a lot of either sharing of automobiles, or in some cases they partnered with like Moto to have one or two cars available. And two of the establishments I visited, when we went down to the parking lot, there were almost no cars in there, so they had rejigged spaces for other communal workshops or storage uses, but they were trying to think of what they could do with their empty parking spot because people didn't feel like they needed as many cars.
Interesting.
Of course, they were on good transit as well, but
yeah, I think it also depends on where the co-op and co-housing is. If you're out in the suburbs, it's a little bit harder to not have car access versus if you're in, you know, in the city or urban center where there's more transit access and things like that. Oh, we have a comment in the chat box. Sure. So less environmental pollution, decreased crime rates in these communities. Yeah. Amy, so I have a question for you. So as a city councilor, do you have any advice for how public health can work better with the city council and the municipalities and partners like that?
Well, I've been here for 6 months, so I haven't had a ton of experience. But when outside presentations come in, it's extremely helpful to learn about health impacts of like built environment that we didn't know about. It's something that, so I think having public health do delegations or presentations or workshops to different city councils can be really helpful. Because it's not necessarily that people don't care, it's just that they don't know. And usually when you start talking about health, people's ears perk up and they're like, oh, yeah, we really care about that in our community. So what can we do? So I think even just bringing up different concepts. When I was working at BCCDC, and this is before I was elected, I did bring some of the Healthy Built Environment toolkits with me to a municipal conference that I was volunteering at, and people were really excited about the ideas that were presented. And so I think anytime you can present a health issue that municipalities can do something about, because often we think about it as more of a federal or provincial jurisdiction, then people are inspired to act. As long as they have money, which is not necessarily always the case. But some of these things aren't necessarily a lot of money driven. There are a lot of public health things that we can do that aren't necessarily money driven.
Fantastic. Thank you so much, Amy. So I think that marks the end of our webinar. I will be sending out an evaluation survey at the end. Please feel free to fill out the survey so we can collect your feedback and improve our webinars and collect your suggestions for topics as well.
Okay, thank you so much for having me, Tina, and everyone.
Thank you. Have a good day.